accessories are really good for pelvic organ prolapse from the uterus or the bladder. They're not as great, unfortunately, if the prolapse is from the posterior wall, depending on the case.
Is the internal work just for the diagnosis and assessment phase, or do you use it also for therapy once you've diagnosed the issue?
So it all depends. So sometimes I would probably say like 70% of times it's also used as treatment. But I have a lot of patients that don't simply feel comfortable with doing it as much. And as long as I know that they are doing it correctly, there is no point in me just having to do an assessment just because. So sometimes I may seem a little bit crude with what I'm going to say, but I do feel like just because we have a vaginal canal, that doesn't mean that we should just allow everyone to do assessment just because. So I do feel like we patients have all the right to just say yes or no to an assessment. And as long as you're doing the right thing, you have all the right to say no to a treatment, like repeated treatment in the area. But at the same time, it does give me a lot of information. So if it is for prolapse, the goals are completely different. So I would say that particularly with prolapse, sometimes pelvic floor weakness can it can become really hard for some people to understand and to be aware. So to have there my hand and my fingers, actually, it will give a lot of feedback. This being said, my hand is not the only way, so they can do it with their own hand, and I highly recommend that. It's the cheapest way that we can do pelvic floor exercises if we have their own feedback, and it's also really good for body awareness because I feel like our culture really connects the pelvic floor with a dirty and dark area. And I really feel like we should embrace our pelvic floor. It's a beautiful area of our body. It self-cleaning itself. It's the only area ever designed to give us pleasure. And I think that's a beautiful thing.
Agreed. With the pelvic organ prolapse, is it possible to correct that with therapy or surgery often required?
Love the question. Depends. So I think above everything, I would love to demystify a little bit pelvic organ prolapse because I think I think social media demonizes it a lot. And with this, I'm not minimizing the suffering of a lot of people at all. But I do think we do need to talk about there is mild prolapse and there is severe prolapse. Mild prolapse, and when I'm talking about mild prolapse, I'm talking about stage 1. About 90% of us have it. And I would like that to be sink there, because if you go to a pelvic floor physiotherapist or a doctor and they imagine you don't have any symptoms and you have a stage 1, 90% of us have at least a stage 1. So I don't think we need to demonize and in a way make pelvic organ prolapse a problem. It's actually a really common thing. The problem arises when it starts being symptomatic, and usually the symptoms of a pelvic organ prolapse is like when it starts being heavy, when it starts giving us also problems in emptying the bladder or the bowel, and overall also the bulge. If you can see the bulge, usually it's also problematic. So can you treat it with pelvic floor physiotherapy? If we're talking about a stage 1, it can actually, we know that if it's slightly symptomatic, pelvic floor physiotherapy can help. The research actually says, though, that it helps more with symptoms. So it helps more with symptoms than actually reducing it completely. This being said, we do have, some people, the fact is it's actually really hard for me to talk about it because we have a lot of research that goes against it. I feel like we are pretty much like in baby steps to understand exactly what pelvic floor physiotherapy can do for pelvic organ prolapse. Because I think the biggest problem we have in research as well is that we usually only use one technique, and I don't think that's physiotherapy, because there's a lot of things that we still do in physiotherapy that it's not only pelvic floor exercises, because I think the problem that has been exactly that. When we talk about prolapse, we only talk about physiotherapy equal pelvic floor muscle exercises. Actually, physiotherapy does a lot more than that. And one of the things that we do is actually return to exercise, like in a good way. So we do know that returning to exercise is actually really good. So even if we think about something as, I'm going to call it extreme, as CrossFit, we do know that people that have pelvic organ prolapse and stress urinary incontinence can actually improve with CrossFit. Some people improve with CrossFit. So I do think we demonize a little bit prolapse, and we also demonize as well like the extreme exercise. There's a lot that we don't know about pelvic organ prolapse, but overall, just to respond to your question, we really know that surgery can help some people, but we do have a 1/3 fail rate, which is a very big fail rate.
Yeah.
So and when we're talking about fail rate, we're also talking about things that when we do surgery, we cannot undo surgery. That's a problem. So surgery should not be the first line of intervention. Pelvic floor physiotherapy, because we can actually help with symptoms, and we can help up to some degree, depending on the severity. I would say that should be the first line of treatment. And then we have pelvic floor physiotherapy. If we can use pessaries, that's why I really feel like if you have pelvic organ prolapse, pessaries and additional to pelvic floor muscle exercises and treatment, that would actually be like the very best access to treatment. Because what pessaries does, have you heard of pessaries, Nelly?
I have, yeah, but it'd be great if you could explain it more for
my pleasure. My pleasure. So if you allow me, so imagine like a pessary is like a little handband, but it's a little bit more. So I'm going to just explain one type of pessaries. There are many types of pessaries, but the most common one is like they are rings or dishes. So imagine this is a pessary. What it does is it tries to lift the organs from the inside. So just to simplify as well, usually pelvic organ prolapse is a problem from the support. It's not the problem of the pelvic floor. So the problem did not start on the pelvic floor, at least not commonly. Usually the problem started because the support at the top was failing somehow. And that usually comes from like for a history of straining, for instance, when you're doing number 2, or particularly mostly common after birth, particularly after forceps surgery or a very long second stage, what the pushing phase. So if it's more than an hour, usually increases a little bit your chances of having pelvic organ prolapse, particularly if you've had your first baby around 40 years old. So we're talking about it's the problem of the support of the ligaments that hold the uterus up. So if those ligaments get a little bit stretched, that means your pelvic floor can support up to some degree. There will be if there is too much movement, your pelvic floor will no longer be able to work as well. That's why pessaries are so amazing, because they don't depend on your pelvic floor to actually help the pelvic floor in a way. What pessaries do is that, like, so imagine this is a ring pessary. If we insert the pessary and imagine that you have the uterus here, so it goes behind the uterus, it lifts the uterus, and by lifting the uterus, it provides a little bit of support to the interior wall, so the bladder, for instance. So pessaries are really good for pelvic organ prolapse from the uterus or the bladder. They're not as great, unfortunately, if the prolapse is from the posterior wall, depending on the pessaries at least. But you have a higher chances of having success if you have, well, first of all, if you have a uterus. So pessaries can fail more if you've had a hysterectomy. So having the cervix for the pessaries usually it makes it a lot easier to work. However, we have to also think that pessaries only have around 65% success rate, and it should not be used by itself. We still need to make sure that the down support, like the pelvic floor, it's doing also its job. Because if you're using the pessary just to support, but you're actually not doing anything on your pelvic floor, you're pretty much not helping your body to be at its best that it should be.